Sexuality in the Etiology of Neurosis. Sigmund Freud. Sexuality in the Etiology of Neuroses. Detailed investigations carried out in recent years have led me to the conviction that the most immediate and practically important causes of all cases of neurotic disease must be sought in factors of sexual life. This theory is not entirely new. Historically, and by all authors, sexual factors have been given a certain importance in the etiology of neuroses, and some lower currents of medicine have also always combined the cure of sexual disorders and nervous weakness in a single promise. It will not be, therefore, difficult to dispute the originality of this theory, if one ever gives up denying its accuracy. In some brief papers published in recent years in the journals Neurologisches Zentralblatt, Revue Neurologique, and Wiener Klinische Rundschau, I have tried to indicate the material and points of view that offer scientific support for the theory of the sexual etiology of neuroses. What I have not yet carried out is a detailed exposition of such a theory, because in trying to explain the body of actually verified data we are continually confronted with new problems, the solution of which requires preparatory work not yet done. On the other hand, an attempt to direct the interest of the practicing physician towards the results of my research does not seem premature to me, in order to convince him, at the same time, of the accuracy of my statements and of the advantages that his knowledge can bring him into practice. Of your activity. I know very well that attempts will be made to divert the doctor from this path using moralistic arguments. In order to acquire the conviction that the neuroses of his patients really have a relationship with their sexual life, he will have to question them insistently about their sexual life until he achieves a complete and sincere explanation, and in this investigation he sees a danger, both for the individual as well as for society. The doctor, it is said, has no right to penetrate the sexual secrets of his patients, hurting their modesty, especially when it comes to females. His clumsy intervention can only destroy family happiness, offend the innocence of young patients and supplant the authority of their parents, finally, to give his own relationship with adult patients an embarrassing and forced character. It is, therefore, for him an ethical duty to remain oblivious to any sexual issue. All this is nothing but the expression of a sanctimiousness unworthy of the doctor, poorly concealed with despicable arguments. If the factors of sexual life are really recognized as pathogenic causes, their study and discussion will constitute an inescapable duty for the doctor. In doing so, he is not guilty of a greater attack against modesty than when he recognizes, for example, the genital organs of a patient to cure a local affection. Of mature women, living in places far from the capital, it is still heard, at times, that they have preferred to exhaust themselves in repeated genital hemorrhages, to consent to a medical examination. The educational influence exerted by physicians has, in the course of a generation, made such cases of resistance among today's women very rare, and if any still arise, it is regarded as ridiculous priggishness. Do we live in Turkey? The doctor would ask, where sick women can only show the doctor their arm by passing it through a hole in the wall. It is not true that the examination and disclosure of the sexual circumstances give the doctor a dangerous power over the patient. The same objection could have been raised against narcosis, which strips the patient of his consciousness and his will and hands him over to the doctor without his knowing when he will recover them, or even if he will recover them at all. And yet, it has become indispensable, due to the irreplaceable services it renders to therapy, the doctor having added to his already serious duties the responsibility of his employment. The doctor can always cause damage when he lacks skill or conscience, but the same in any of his professional interventions as in the investigation of sexual life. Naturally, those who, after a severe examination of their personality, do not allow themselves the tact, severity, and discretion necessary for the examination of neurotics, and know that discoveries of a sexual nature must awaken in them a voluptuous, tickling rather than rigorous scientific interest, will do well to stay away from the subject of the etiology of neuroses. For our part, we only ask you, furthermore, not to dedicate yourself to the treatment of nervous patients. Nor is it correct that patients oppose insurmountable obstacles to an investigation of sexual life. Adults often put an end to their hesitations at once by reflecting that the doctor may know everything. For many women forced to hide their sexual impulses in their relationship life, it is a relief to realize that the doctor puts their cure before everything else, allowing them to adopt, at last, sometime a frank, purely human attitude towards sexual things. In the common consciousness there seems to have always been a dim knowledge of the importance of sexual factors in the genesis of nervousness. In my consultation I have witnessed numerous scenes of the following tenor. We are presented with a married couple. One of the spouses suffers from neurosis. After many detours and reflections, such as the one that if the doctor wants to achieve some success in these cases he has to excuse with certain conventions, etc., we communicate our suspicion that the reason for the disease lies in certain sexual practices, unnatural and harmful, adopted by them after the last childbirth of the woman. At these words, one of the spouses turns to the other and says, "Do you see it? I told you that would make me sick." And the respondent replies, "I thought so too, but what were we going to do?" In other different circumstances, for example, when dealing with young girls, who are generally brought up to systematically cover up their sexual life, the doctor has to content himself with less sincerity. He will then take care not to confront the sexual question without a thorough preparation, so that he does not have to demand any previous clarification from the patient, but only the confirmation of his hypotheses. Those who agree to abide by my indications on how to translate the morphology of neurosis into etiological language will not need to go, to a large extent, to the confessions of patients. With the description of their pathological symptoms, always revealed willingly, the patients will inform them, in general, of the sexual factors that are hidden behind such symptoms. It would be very advantageous if patients were more aware of the certainty with which the doctor can now interpret the nervous disorders that afflict them and deduces their sexual etiology. This would lead them to dispense with all concealment from the moment they decided to ask for the help of science. It is in everyone's interest that also in sexual matters a greater sincerity be observed among men, as a duty. This would greatly improve sexual morality. Currently, all of us, sick and healthy, are guilty of hypocrisy in this order of things. The general sincerity would have to bring with it a greater tolerance to all convenience. Some of the problems discussed by neurologists have yet to attract the interest of physicians. Thus, the strict differentiation of hysteria and neurasthenia, the distinction of a hysteroneurasthenia, the ascription of obsessive representations to neurasthenia or its recognition as a special neurosis, etc., etc. In reality, such differentiations may be indifferent to them as long as they do not link to them a deeper knowledge of the disease and a therapeutic norm and limit themselves to advising the patient, in all cases, a hydrotherapeutic cure, or to tell him that his ailment is purely imaginary. Not so, however, if they accept our views on the causal relations of sexuality with neurosis. Then a new interest in the symptomatology of the various neurotic cases awakens, and knowing how to accurately dissociate the components of the complicated pathological picture and give each one its exact name acquires great practical importance. Indeed, it is easy to translate the morphology of the neuroses into etiology, and new therapeutic indications derive by themselves from this etiological knowledge. The detailed examination of the symptoms always allows us to establish an important differential diagnosis, showing us if the case in question presents the characteristics of neurasthenia or those of a psychoneurosis, hysteria, obsessive representations. Mixed cases also arise with extraordinary frequency, in which the signs of neurasthenia appear together with those of a psychoneurosis, but we will deal with them later. Examination of the patient only in neurasthenia reveals to us the sexual etiological factors, which in these cases they are known to the patient and belong to the present or, better said, to the period that extends from the time of his sexual maturity, although this limitation may not apply to all cases anyway. In psychoneuroses, such an examination provides us with little yield. It only facilitates, eventually, the knowledge of factors that we have to recognize the category of occasional pathogenic reasons, and that may or may not have a relationship with the sexual life of the subject. In the first case, they are the same as the etiological factors of neurasthenia, not presenting, therefore, a specific character with regard to the cause of the neurosis. And yet the etiology of the psychoneuroses also rests again and again on sexuality. Taking a singular detour, which we will talk about later, we managed to get to know this etiology and to understand that the patient did not know how to tell us anything about it. The events and influences at the bottom of every psychoneurosis do not belong to the present, but to a very past time in the life of the subject, to his early childhood, having been forgotten later, although only in a certain sense, by the patient. All cases of neurosis thus have a sexual etiology, but such etiology is constituted by current events in neurasthenias, and infantile events in psychoneuroses, this being the first important antithesis in the etiology of neuroses. A second antithesis derives from the difference in the symptomatic picture of neurasthenia. In this disease we find, on the one hand, cases that first present certain disorders characteristic of neurasthenia, head heaviness, fatigue, dyspepsia, constipation, spinal irritation, etc., while there are others in which the symptom picture appears made up of different syndromes related. All with anguish as a central disturbance, startle, restlessness, fears, rudimentary and supplementary panic attacks, locomotor vertigo, agoraphobia, insomnia, hyperesthesia, etc. Leaving the name of the first of these types of neurasthenia as such, we have given the second the name anxiety neurosis, differentiation that we had to justify already in a previous work, in which we also tried to explain the general joint appearance of both neuroses. For our present purposes it will suffice to emphasize that a different etiology corresponds to the symptomatic difference between these two forms of neurosis. Neurasthenia is always attributable to a certain state of the nervous system, arising as a result of excessive masturbation or continuous spontaneous pollution. In the genesis of anxiety neurosis we regularly find sexual influences whose common character is continence or incomplete satisfaction, thus, coitus interruptus, abstinence in individuals with a very intense libido, the so-called frustrated arousals, etc. In the short essay, in which we try to introduce the anxiety neurosis into the morphology of the neuroses, we already formulated the principle that anxiety is, in general, libido diverted from its goals. In mixed cases in which symptoms of neurasthenia and anxiety neurosis occur together, we stick to the empirically discovered principle that a mixture of neuroses corresponds to a joint action of several etiological factors. This principle is always confirmed in practice, and it would be interesting to examine how often these etiological factors are organically linked to each other by the connection of sexual processes, e.g. coitus interruptus or insufficient male potency, with masturbation. Once a case of neurasthenic neurosis has been safely diagnosed, and its symptoms have been exactly grouped, we can now translate the symptomatology into etiology, and then ask the patient for confirmation of our hypotheses. Without allowing ourselves to be disoriented by his initial refusal, we will insist on our deductions, and our firm conviction will end up overcoming all resistance. In this work we learn enough to compose a highly instructive treatise on the sexual life of man, imposing on us more and more the need to free sexual science from the interdiction that weighs on it. Bearing in mind that small deviations from sexual normality are too frequent to attach value to their discovery, we will only accept from the neurotic patient, as an explanation for his aid, a serious and lasting abnormality in his sexual life, without this insistence on our part. The search for a sexual etiology can never lead a mentally normal patient to attribute imaginary sexual sins to himself, as has once been suspected. Following this procedure with our patient, we also acquired the conviction that the theory of the sexual etiology of neurasthenia has no exceptions. This conviction has become so absolute in me that the negative result of the examination assumes a diagnostic value in my eyes, leading me to suppose that such cases cannot be neurasthenic. In this way I have come to diagnose several times a progressive paralysis instead of a neurasthenia for not having been able to verify that the patient indulged in excessive masturbation, a necessary premise of my theory, and the subsequent course of these cases has always proved me right. In another patient, who without showing clear organic changes complained of headaches and dyspepsia, and opposed my sexual suspicions with a firm and constant denial, whose sincerity could not be doubted, it occurred to me to diagnose a latent suppuration in one of the cavities. Sinuses, and a rhinologist totally confirmed this diagnosis, deduced from the negative sexual examination, completely curing the patient by means of an operation, in which he had to cause the release of a large amount of fetid pus, contained in Hymer's cavity. The existence of negative cases can also be feigned by other circumstances. We find, in fact, cases in which the examination reveals a normal sexual life, although we are dealing with patients whose neurosis presents at first sight all the characteristics of a neurasthenia or an anxiety neurosis. But a more penetrating investigation always ends by discovering the truth. Behind such cases, in which at first we thought we saw a neurasthenia, hysteria, or an obsessional neurosis, lurks as a psychoneurosis. Especially hysteria, which imitates so many organic affections, can easily feign one of the forms of the current neuroses, elevating their syndromes to the category of hysterical symptoms. Such hysterias of a neurasthenic form are not at all rare. However, it should not be believed that the option of accepting psychoneuroses in cases of neurasthenia with a negative sexual examination is not without difficulty. To establish the new diagnosis, we have to resort to the only method that can lead us without error to the discovery of hysteria, that is, psychoanalysis, which we will talk about later. Although those who are willing to take sexual etiology into account in their neurasthenic patients will perhaps be inclined to judge us unilaterally when they see that we do not invite the doctor to also attend to the other factors cited by writers as causes of neurasthenia. Thus, we must state that it is very far from our intention to completely substitute these factors for sexual etiology and thus deny them any influence. We limit ourselves to stating that to all the etiological factors recognized by writers in the genesis of neurasthenia must be added the sexual ones, neglected until today. Now then, these sexual factors occupy, in our opinion, in the etiological series, a preeminent position, as they are the only ones that appear in all cases of neurasthenia, without exception, and the only ones capable of producing neurosis by themselves. Thus, the other factors are reduced to the category of an auxiliary and supplementary etiology. Only these sexual factors allow the doctor to discover unquestionable relationships between their diversity and the variety of pathological pictures. On the other hand, those cases in which the subject has fallen ill with neurasthenia, supposedly as a result of overwork, intense emotions, typhoid fever, etc., do not show anything common in their symptoms, nor do they allow me to deduce from the etiology the probable symptomatic picture, or conversely, of the syndromes, the cause. Etiological. Sexual causes are also the ones that first offer the doctor a point of support for his therapeutic action. Heredity is undoubtedly an important factor when it really exists, since it allows the emergence of serious pathological defects in cases that would have been mild without heredity. But heredity is inaccessible to the influence of the doctor. Each individual brings to the world certain predispositions, against which we can do nothing. However, we must not forget that it is precisely in the etiology of neurasthenias that heredity must be denied first place. Neurasthenia, in its two forms, belongs to those conditions that every individual exempt from hereditary defects can acquire without difficulty. If it were not so, its current extraordinary increase, so lamented by all writers, would be incredible. As far as civilization is concerned, to which the cause of neurasthenia is usually attributed, perhaps the authors are also right, although in a different sense from what they affirm, but the state of our civilization is equally unchangeable by individual action, and is also a factor whose general influence on the choice of pathological form is never explained by members of the same society. The non-neurasthenic physician is under the same supposedly disastrous influence of civilization as the neurasthenic patient whom he has to treat. The importance of exhausting influences remains subsisting with the aforementioned restriction. On the other hand, Surmenage is extraordinarily abused as an etiological factor. Or neurosis. It is true that the individual predisposed to neurasthenia due to his harmful sexual practices bears poorly the intellectual work and the psychic efforts of life, but work and excitement alone do not lead anyone to neurosis. On the contrary, intellectual work is an excellent protection against neurotic diseases. Precisely the most resistant intellectual workers are respected by neurasthenia, and the surmenage, to which neurasthenics attribute their illness, hardly ever deserves, either because of its quantity or its quality, the name of intellectual work. Physicians will have to get used to explaining to the clerk who claims to have killed himself working in his office, or to the woman whose housekeeping is too heavy for them, that they have not fallen ill from trying to perform their duties, which are really easy for a man. Civilized brain, but for having meanwhile grossly neglected and spoiled his sexual life. Only the sexual etiology also makes it easier for us to understand all the details of the clinical histories of neurasthenics, revealing to us the causes of their enigmatic improvements in the course of the disease and of their aggravations, no less incomprehensible, usually related by patients and physicians with the therapy undertaken. In my collection, which includes more than 200 cases, I find that of an individual who, after a cure at the Wowerashofen establishment, spent a whole year remarkably improved. After this time, he relapsed and went back to the aforementioned spot, hoping for another improvement, this time without obtaining any relief. A glance at the family chronicle of this patient solved the double enigma. 6.5 months after his first return from Wowerashofen, his wife had a child. It turns out, then, that when he separated from his wife to undertake the cure, she was at the beginning of a still unknown pregnancy, and on his return the subject was able to engage in normal sexual intercourse with her. But when, after childbirth, she resumed coitus interruptus, the neurosis arose again, and the new cure did not give any results, since when she returned home she had to continue the pathogenic practice. Another analogous case, in which it was also possible to elucidate an unexpected effect of the therapy, was even more instructive as it presented an enigmatic transformation of the symptoms of the neurosis. A nervous young man had been referred by his physician to an excellently run hydrotherapeutic establishment for relief from a typical neurasthenia. The patient's condition immediately began to improve visibly, leading to the expectation that our subject would leave the spa as an enthusiastic supporter of hydrotherapy. But in the 6th week a change came. The patient no longer tolerated water, he was becoming more and more nervous, and after 2 more weeks he left the establishment. When he later came to me, complaining of such a deception in therapy, I made him aware of the symptoms that had attacked him in the middle of the cure, verifying in them a singular change. Upon arrival at the spot, he suffered from heaviness in the head, dyspepsia, and fatigue, and the symptoms that interrupted the cure had been excitement, attacks of oppression, dizziness when walking, and insomnia. I was then able to tell him the following: "You are unfair with hydrotherapy. As you well know, your illness is due to continued masturbation. At the spa you have stopped practicing this kind of sexual gratification, and have thus obtained a rapid improvement. But just when you were beginning to feel good, you have been reckless enough to start, perhaps with a lady from the same spa, relationships that could only lead to sexual arousal without further satisfaction. Such relationships, and not a sudden intolerance of hydrotherapy, have caused him to relapse into his illness. From your current state I also deduce that you still continue to see said lady here, in the capital." The patient confirmed my words point by point. The current therapy for neurasthenia, as it is practiced in the best spas, tends to relieve nervous states, toning and calming the patient. In my opinion, he can only be blamed for neglecting the sexual conditions of the case. My experience inclines me to wish that the medical directors of such establishments realize clearly that their patients are not victims of civilization or heredity, but sit venia furbo invalids of sexuality. In this way both their successes and their failures would be better explained, and they will also tend to achieve new positive results, entrusted today to chance or to the spontaneous behavior of the patient. When a woman suffering from anxiety and neurasthenia is taken out of her house and sent to a spa, where, free from all care, she is subjected to a regimen of baths, gymnastic exercises, and proper nutrition, she will tend to see in the brilliant improvement, achieved in a few weeks or months, a result of the repose enjoyed by the patient and the toning work of hydrotherapy. Can be, but thinking in this way, one forgets that by taking the patient away from home there has also been an interruption of conjugal intercourse, and that this exclusion of the pathogenic cause is what makes it possible to achieve improvement, with the help of adequate therapy. The neglect of this etiological point of view is later avenged by the ephemeral duration of the improvement obtained. Shortly after the patient resumes her normal life, the pathogenic symptoms reappear, periodically forcing her to spend time in such establishments or to direct her hopes of cure to other means. It is, therefore, unquestionable that in cases of neurasthenia, therapeutic action must directly attack the circumstances in which the patient lives and not those to which he is transferred in the spa. In other cases, our etiological theory may give the spa doctor the clue to the failures of hydrotherapy and provide him with the means of avoiding them. Masturbation is much more frequent in pubertal girls and mature men than is believed, and it is harmful, not only by giving rise to neurasthenic symptoms, but by keeping the patients under the weight of a shameful secret. The doctor, not used to translate neurasthenia into masturbation, attributes the pathological state to anemia, insufficient nutrition or overuse, and entrusts the cure of the patient to appropriate therapy for such causes. But to his surprise, periods of improvement alternate in the patient with others of profound darkening and intensification of all the symptoms. The result of such treatment is always doubtful. If the physician knew that the patient struggles all the time with his sexual habit, falling into gloomy despair when he has been forced to yield to it once more, and if he possessed the means of wresting his secret from him, he would lessen its gravity in the eyes of the patient. And by supporting him in his fight against the pathogenic habit, therapeutic success would be assured. The dishabituation of onanism is one of the new tasks that the recognition of sexual etiology poses to the doctor, and can only be carried out, like all other cures of this kind, in a medical establishment and under the continuous supervision of the therapist. Left to himself, the masturbator resorts to the usual comfortable satisfaction whenever he experiences some setback. Medical treatment can have no other purpose here than to lead the neurasthenic back to normal sexual activity, encouraged by adequate auxiliary therapy, because the sexual need, once aroused and satisfied for a long period, can no longer be silenced, and yes only derived by another way. This observation can also be applied to other withdrawal cures whose positive results will remain apparent and ephemeral as long as the doctor limits himself to removing the narcotic medium from the patient, without worrying about the source from which the imperative need for it arises. The habit is nothing but a mere locution, without any explanatory value. Not all individuals who have had the opportunity to take morphine, cocaine, etc., for some time, develop the corresponding drug addiction. Careful investigation generally reveals that these narcotics are intended for compensate directly or indirectly the lack of sexual enjoyment, and in those cases in which it is no longer possible to re-establish a normal sexual life, a relapse can be safely expected. The etiology of anxiety neurosis presents the doctor with another new task, consisting of moving the patient to abandon all harmful forms of sexual intercourse and to initiate normal sexual relations. This duty naturally falls to the attending physician, who will do his clients great harm if he considers himself too distinguished to deal with such matters. In dealing here generally with married couples, the doctor's efforts soon come up against the Malthusian tendency to limit the number of pregnancies. There is no doubt that in our middle class these trends are becoming more and more widespread. I have found married couples who began to put them into practice after the birth of their first child, and others who observed them already on their wedding night. The problem of Malthusianism is too broad and too complicated for us to be able to discuss it here with the care that the therapy of the neuroses required. We will therefore have to limit ourselves to indicating what is the best activity that those doctors who recognize the sexual etiology of neurosis can adopt before him. The most mistaken thing would be, of course, not to take it into account, whatever the alleged reason. What is necessary cannot be below my medical dignity, and it is undoubtedly necessary to assist a married couple intending to limit the number of children with medical advice, if one or both of the spouses are not to be exposed to neurosis. Finish. Sexuality in the Etiology of Neurosis. Sigmund Freud.